I want to bring in now from Kardigan, South San Francisco headquarters, Kardigan co-founder and CEO Tassos Gianakakos. Tassos, thank you so much for being with us. Talk about these specific drugs that you have in development, specifically the one that targets calcium in the heart valve.
It's great to be on the show. Thanks, Cheryl, for having me. And thanks for shedding some light on cardiovascular disease. As you pointed out, #1 killer of everybody. 1 in 3 people are touched by this disease. And paradoxically, we're really underinvested. We are focusing our pipeline on 3 late-stage programs, 1 in a genetic form of heart failure, 1 in a really severe form of hypertension called acute severe hypertension. And the one you mentioned is focused on aortic stenosis or calcific aortic valve disease. And we believe, a medicine that will be the first one ever. Right now, if you're diagnosed, you're basically asked to wait until the valve actually gives out. And we've got a medicine that we believe has the potential to be the first one ever that actually addresses the underlying drivers of the disease, which are buildup of calcium on the valve, but also the dysfunction that happens in the heart itself as it's working a little extra to get through this non-compliant and diseased valve.
Where are you in the process of approval and testing?
Well, so for this program in particular, we're in phase 2 and we're hoping to move to phase 3 soon. We'll have data from the phase 2 program in the first half of next year. It's a very exciting time for us. Our other 2 programs are similarly staged. 1 is in a registration program, the genetic heart failure program, and the acute severe hypertension program is also in phase 2, moving forward into phase 3 soon.
You say that the industry in general is underinvested in the treatment of heart disease, in particular the root cause of heart disease. We know that we're supposed to exercise and eat right and keep our weight down, etc. But why do you think and why do you say that there's been an underinvestment of this treatment?
Yeah, exercise and diet are things we should always do. But when you think about the underlying drivers of disease, we've got to get at them. And we haven't done that as an industry. Typically, the way that our industry has developed drugs for cardiovascular disease requires very large studies, often tens of thousands of people in these studies. These patients they share a diagnosis, but they have different underlying drivers. So the key here is we're not necessarily targeting the root cause, which makes it that much harder to get to medicines that actually affect the disease progression. And what we have, by and large, are very expensive, time-consuming studies and investments that really just address symptoms. So if you are an investor or if you are a drug company with a broader portfolio and you have choices, the return on investment leads you often to these other places. What we do that's different, by targeting the root cause, we can get to very efficient small studies, hundreds of patients, right? We've seen this work in areas like oncology and rare disease, and we can do this much more sharply with higher probability of success in a shorter period of time. But the key is really being comfortable and focused on getting at these underlying biological drivers and not just bringing everybody in that's a heterogeneous mix of folks leading you down a path of a tricky investment proposition.
Yeah, and you're using AI and of course wearables and real world data from patients, but you raised about $400 million from your IPO. So what do you want to do with the money?
Yeah, we're going to advance this pipeline, or we're going to try and responsibly, but as quickly as we can, get these medicines to patients who are really sorely waiting for them. Every single one of these patients are in disease areas where there are no approved therapies. And this is what we're here for. This is what gets us up in the morning. And so this capital is a great launch pad and fuels our ability to move these programs now into even closer to a point where the FDA can review them for approval.
All right. Well, Tassos Gianakakos, thank you so much. We're going to be watching, of course, the development of these new therapies, and we'll be watching the stock as well. Thank you for being with us.